Hi, everyone. Welcome to the Children's Craniofacial Association's webinar series. We're very excited to be bringing you another webinar today that will be posted on our socials and on YouTube for on-demand watching. So welcome whenever you happen to be viewing this. We're so excited to have with us today Dr. Gregory Borschel, the Chief of Plastic Surgery at Riley Hospital for Children. And it was my great pleasure to meet Dr. Borschel at the Moebius Syndrome Foundation conference this past summer, which is 2023 for everyone who's watching on demand. But we met, I saw his presentation over breakfast one morning, and it was just a big surprise to me because this is something new to me, and I try to stay current with things happening for patients with all different craniofacial syndromes. But this was a great presentation of research, I know in part funded by the Moebius Syndrome Foundation. And I thought it was just a beautiful collaboration of work. And when I heard about it, I thought the CCA families absolutely need to know about the blink reconstruction surgery that Dr. Borschel presented on. So he's with us here today to present it to our CCA families. And before I turn it over, I'll just read our quick little disclaimer that we like to start our webinars with, just so everyone is reminded. The session is for informational and educational purposes. It is not intended to diagnose or treat anyone specifically. We cannot offer individualized medical advice, but we can share from our professionals' research and help direct you to a team if you are looking for someone. For medical advice and professional help, we always suggest you contact your personal medical doctor or craniofacial team. And please understand that the views, thoughts, and opinions expressed in this program belong solely to the speakers and not necessarily to CCA, the speaker's schools, employers, organizations, committees, or groups or individuals. And as a reminder, we are thankful for the support we receive from people across the country who count on the care and programming that we provide. Gifts of any size from our growing virtual audience help fulfill our mission of empowering and giving hope to individuals and families affected by facial differences. And as a quick side note, I also want to say that I'm just super grateful for the collaboration offered by Jenny Whitman and the Moebius Syndrome Foundation, because it has brought so much richness to our community in just the past few months alone. But it's been building on a very long track of collaboration. So with that, I happily turn it over to you, Dr. Borschel.
Thank you very much, Erica. And it was great getting to know you at the Moebius meeting. And it's a pleasure to be in front of you and presenting to CCA. Thank you very much for having me. As you know, I'm very excited about this topic. It's something that I've really focused on for a long time, but it doesn't really get a lot of exposure. So I'm really, really glad to be part of this and present the material to the families in the CCA. So we were actually asked by the Moebius Syndrome Foundation to kind of do something about blink reconstruction. So these patients have issues with facial paralysis, and including that is blink. And historically, there really haven't been any good treatments for it. And so this is really a grassroots way that Moebius Syndrome Foundation has tried to advance the care of their members with doing something like this, something surgical and research-based. I wanted to thank the members of my team, some of which are listed here, as well as collaborators Ron Zucker, Kathleen Bogart, in addition to my team members, Chalando and Mario from here in Indiana. So it's been a great partnership. Here's a QR. If you want to look at some of the literature and some of the supporting materials, feel free to capture that and follow it. And with that, we'll kind of dive in here. So blink, there are functional and aesthetic concerns associated with blink. And this is a little girl with Moebius. She's trying to basically move her face, and that's the maximal amount of movement in terms of smiling and eyelid closure that she can generate. And as I mentioned, this is something that's really been a patient and a family-driven project. Very important, grassroots. So what are we trying to do with this? Well, one, we're trying to develop a surgical operation to enhance blinking for patients with Moebius syndrome. And this is very important, and I'll get into why. Second, we're trying to determine what aspects of blinking are concerning and important to patients with Moebius syndrome. So why do this? And then finally, we wanted to, and this will come later, assess the extent to which any blink surgery would address these concerns. So we're trying to approach this from a very anatomic standpoint, a very scientific standpoint, and get feedback and the input from the patients and families that are dealing with this. So we've got a long history. When I was working in Toronto with Ron Zucker and now down in Indiana, got a long history of doing smile surgery, which is relied on transplanting muscles, typically the gracilis, which is a little piece of a thigh muscle up to the face to provide smiling. And then it's activated by a nerve that's ordinarily used for chewing. So this is something that we've been doing for a long time, transplant a little segment of muscle up to the face. And then the control for that muscle is a biting nerve, which is available in most patients with Moebius syndrome. This is kind of a close-up. So in this operation, the so-called smile surgery, we transplant a little piece of muscle, and then to activate the new muscle, the patient has to first bite down in order to provide this kind of smiling movement. And here's one example of one of our patients before surgery, and he's trying to generate a smile. He has a little bit of blink function here, which is nice, but he has no smile. And so the concept here is transplanting segments of muscle up to the face. And then here he is later. We caught up with him at the Moebius meeting, and he can use this muscle to generate smiling movements that he can initiate whenever he wants. So that's kind of the backstory that got us sort of on this trail. But then what about the eyes? So for the longest time, we as surgeons, we would focus on this part of the face, the mid face, the smile, and we didn't really think about this part of the face. But, certainly during COVID, everybody knows this story. Here we are, we're using masks, and then our eyes are exposed, and then people just naturally, frequently will try to smile with their eyes. They'll try to provide emotional expression, feedback with their eyes. And for many people, if not most, that's kind of an instinct to do this. But if you have facial paralysis, it can be very hard to do. And here's an interesting study. Where do we look at if we're looking at somebody that has facial paralysis? And where are we looking ordinarily at somebody who doesn't have facial paralysis? So in this study, the investigators used a way of tracking where people are looking. And then these panels on the left are images of a person who does not have facial paralysis. And you can see that a large amount of attention is given to the eyes, the mouth too, but a lot of attention is given to the eyes. And that's really where we look. Either if somebody has facial paralysis and we're looking at them as shown on the right, or without as shown on the left. In either case, with facial paralysis or without facial paralysis, most of the time we are focusing on the eyes. So it tells us as surgeons, in addition to what the patients and families are telling us, we need to be focusing on the eyes too, and not restricting our attention as we have historically to the middle part of the face. So that's kind of the backstory. This slide is intended to show that we can measure reliably facial movements, and we can do this in a structured and repeatable way. There are ways of making these movements so we can study it. It opens the door to study of this kind of movement. One thing we had to do when we sat down to try to develop a new operation for blinking in patients that can't blink was to go to the anatomy lab. So what I'm about to show are samples of faces from the anatomy lab. So if this is something that you might find disturbing, then I would say look away for now, and I'll cue you when it's okay to look again. So we had to do pre-surgical simulation and planning to try to figure out what's available and how can we do this new operation. So with that, one thing that we needed to do is find nerves that might be available to use for patients with this problem. So we did that. We went to the anatomy lab and we had to locate where these nerves to the temporalis muscle are, where the strategy would be try to find nerves that power this chewing muscle called the temporalis. And it turns out that there's multiple of them, and they're about 4.6 centimeters or a couple inches in front of the tragus or anterior to the tragus, which is this part of the ear. So if we start looking around this area right here, that's where they are. And then we published this work. It's all anatomically based to try to find a nerve that would power a new source for blinking. So we had to do that work.
Okay, now give me a big smile.
I'll just turn this down here. Another thing that we learned was when we were treating patients that had hemifacial microsomia and blink deficits, so unilateral. So unlike Moebius, here's a patient where he has trouble with movement on one side of his face, and he's got a blink deficit on one side of his face. So the idea here was to bring in nerve power from one side of the face that was operational and then bring it into the paralyzed side. So here he is before surgery, and you can see that he's got issues with blink. And we can kind of run that back. Whereas blink, he has a strong blink deficit. And in his case, we brought innervation in the form of a nerve graft from the working side of the face, tapped into the nerve power in the working side of the face, tunneled the nerve over to the paralyzed side, and then in a second stage, both for smile and also for eyelids, brought in a new muscle to enable smiling and then assist with eyelid closure. So he's one of the very early patients. You can see that he's gained a nice smile, not perfect, but nice. And then in addition, a greater ability to close his eyes. What's nice is he's able to kind of use this. Here he's arguing with one of his aunts. This is long after surgery. He's arguing with his aunt over who's better at Fortnite. And he really uses this reconstruction a lot. He says he's better than his aunt at Fortnite. I would tend to believe him.
Yeah, I would too.
Another patient, this is a girl who was born with congenital developmental unilateral facial paralysis. So she was born with basically very little movement on one side of her face. And here she is before surgery. And in concept, the surgical plan was the same as the boy I just presented. So she has very little movement on one side, but she's got intact movement on the other side. So unlike the patients with Moebius syndrome who have no movement typically on either side, she had movement on one side. And so we could tap into that nerve power, bring it across from the working side for the eyelid and then for smile. And then in a second stage, bring in a new muscle powered by these new sources of nerve power. And then here she is after surgery. And we're kind of keeping up by video here. So she's got a new muscle to power smiling. And she's learning to use it. She's not perfect. She still has some residual asymmetries to be sure. I think that was her little sister that just ran across in the background. If she squeezes down, you can see the new muscle in the eyelids activating. She really kind of has to try and then gradually is learning to use it. And it's quite interesting. You know, some of the patients are reporting that the kids get off their eye drops, so they're all put on eye drops. We don't tell them to do this. They just reported, oh, we got off eye drops and everything seems to be okay, which is a kind of an unintended consequence. Nice to hear. So that was kind of what we were learning from the patients where we were doing this unilateral reconstruction. One question that sometimes comes up, in this case, Moebius from this publication, what about measuring facial movements over long periods of time? So how durable are these nerve and muscle-based reconstructions? So we asked that question, and these are patients that are part of the Moebius Syndrome Foundation that had surgery on both sides, patients with Moebius syndrome. And then preoperatively, they have very little movement, less than a millimeter of movement. And then in the early postoperative period, they gained about 10 millimeters of movement, about half an inch or so. And then long-term, when measured over 10, 15 years later, and you can see this boy getting older, and then here he is as a man, the power of the muscle is essentially maintained. So it's a durable reconstruction. It doesn't wear out. It doesn't get tired. It doesn't reject. It's part of the patient because it's their own body that's been transplanted. So with this blink surgery, the question comes up, who is a candidate for surgery? Well, it depends. Not everybody's really a candidate for it, but and it requires a functioning temporalis muscle, that's this muscle here. If you bite down, if you feel here and then bite down, you can feel this muscle bulging. The patient has to have a donor source of nerve power. So this muscle should be working, and then we can borrow from it because there's multiple nerves, and then tap into it with a little nerve graft, and then bring that nerve graft across into the eyelids in stage 1. And then in stage 2, after the nerves have grown into the eyelids, we can add a new muscle to the eyelids. It's very similar to what we do for SMILE, where we bring in a new muscle, then it's powered by a chewing nerve. So that's important. There has to be a donor source. So a functioning muscle, for example, the temporalis, which is this one here. Another thing that should happen is there should be in place. There should be strong eyelid opening ability. And not everybody has this. So it's very important to be able to open the eyelids and close them because we don't want to overpower either one. So on the one hand, we don't want to have an eyelid that can only open and not close. That's not so good because it can lead to exposure of the cornea and problems with vision. And then additionally, we don't want to have overactive closure where the patient can't open their eyes either, because that's a problem too. How long are these operations? The nerve operation lasts about 3 hours. The second operation with the muscle transplant lasts about 3 hours as well. And if we're adding the part for SMILE, that adds a little bit more time as well, a few more hours on top of that. How long do the patients need to stay in the hospital? After stage 1, which is the nerve part, generally 1 night is enough. And likewise, after the muscle part, 1 night. And if we're adding the part for smiling, then we usually keep patients in the hospital for 3 nights, sometimes more. And then to stay in town, it's usually advisable to stick around town for a few days afterwards. Then we can do a nice check, make sure everything's okay before patients go back home. We get this question a lot. Does insurance cover this surgery? Yes, it does. We have to write a letter of what's called pre-authorization. And we do that by structuring it such that the insurance companies, without fail now in 2023, cover this surgery. In the past, it was an issue, but we figured out ways of expressing it where it does get covered by insurance. Another question, will I need to bite down to close my eyes? And the answer is, like the SMILE surgery, biting down will be part of the initial rehabilitation program. And then later on, many patients are actually able to smile without biting. So with the concept here being very similar, the experience of the patients should be similar too, where initially they would have to bite down to try to get the most power, and then gradually they wouldn't necessarily need to bite down, but they would need to at least semi-consciously initiate the movement. Another question, will I need to enroll in a study? No, we conducted some of these initial studies at the Moebius Syndrome Foundation meeting. It isn't required, but it would help. It would definitely help. We're all trying to, advance this component of the care of patients with facial paralysis. And the more we learn and the more feedback we get, the more input we get from the patients and the families who are actually in the trenches dealing with this, that'll allow us to help fine-tune what's going on and make it better over time. So as I mentioned earlier, one thing we're trying to do, in addition to develop the operation, is to determine what aspects of blinking are concerning to patients with Moebius syndrome or bilateral facial paralysis, or even unilateral. And we're trying to measure certain things. Eyelid closure, we can measure that, as I mentioned. The synchronicity, that is, do the eyelids close at the same time with SMILE? What about the ability to chew after this operation, which so far hasn't been an issue? And then there are other questions too, looking at psychosocial impacts. What about sleep? It's becoming a big issue. Kathleen Bogart is a leader in this. And then we also, as I kind of briefly mentioned, we want to look at the reliance on ocular lubricants, drops, this kind of thing. And then again, other aspects, looking at sleep, and then looking at what's going on in the brain as well, downstream. So at the Moebius Syndrome Foundation, we conducted a blink focus group, and the goal was to understand the impact of limited eyelid closure on daily activities, appearance, social interactions. And then we administered questionnaires looking at redness, dry eyes, eye soreness, pain. What are the problems that people are happening? What kinds of problems do people have when they have issues with eyelid closure, feeling, and so forth? So we conducted these group discussions, and then we had a moderator facilitate the structured discussion. We took videos, audio recordings, and then the analysis is underway. And then we have a number of collaborators, as I mentioned, Dr. Kathleen Bogart, wonderful researcher, widely published, qualitative outcomes research. She's been part of it. Logistical assistance through personnel like Laura Linz and MSF. And then we conducted multiple focus groups. So I'd like to close out. I don't know if anybody in this organization knows 𝐓𝐰𝐢𝐭𝐚𝐿. She was kind of the instigator. She started this whole thing when her son was born over 30 years ago with Moebius Syndrome Foundation, and nobody knew what to do. She was in a rural town, rural Missouri, and she was, and still is, the driving force, I would say, behind this organization. And she really got the ball rolling, and she's just a wonderful person, wonderful resource, and she's really just kept this, she's been the heart and soul of this family-run, family-operated organization that I've been really happy to be kind of part of here for so many years. So I just want to close out with a big thanks, not just to Vicky, but all the members of the Moebius Syndrome Foundation. And again, I want to thank you in the CCA for listening to this. Feel free to pass this on. Feel free to pass around my email if there's questions, facial paralysis. Let me know. Drop me an email. No problem. I'm on Instagram. I'm really not a very good Instagrammer, I have to admit. But I do have that there anyway, because some people find it easier to connect. And then I want to thank again my colleagues at Riley in Indianapolis, and also those back in Toronto where I used to work for many years. So with that, thank you, and I'm looking forward to any questions that you may have in the future. And Erica, thank you again for the very kind opportunity to speak to your group at CCA.
Oh, thank you so much. We are just honored that you would. And I can say just from our interactions through email and at the conference, it's just so nice to find providers who are truly, you said heart and soul earlier. And that's what I characterized my whole experience at the conference. I was like, that's the heart and soul. You guys are an amazing group of people and medical professionals. And so being so open and willing to present and talk to patients and give them options has been extremely heartwarming and encouraging. And it gets me excited for our family and our craniofacial community. So I appreciate that. Definitely you all who are watching can see the contact information here. Feel free to email questions. Obviously, if you comment on the YouTube, we love to see the kudos and support, but questions, let's address them to Dr. Borschel. So thank you again so very much for taking time out of your day and for being willing to share this and to help more folks. We're excited to share.
Absolutely, Erica, and thanks again for the opportunity.
Absolutely.